Hello, everybody, and thank you for joining us today, and welcome to Driving Innovation and Impact in Pediatric Care. My name is Ian Miller. I'm a program lead here at the Digital Medicine Society, and I'm really excited to be here today on behalf of DIME to share the launch of the Playbook Pediatric Digital Medicine. Before we dive in, just want to run through a very brief agenda for you all. So give you a quick background of the project, and a very short overview of all the resources that we've developed as a team here. And then we'll move into the bulk of the session today, which is really panel discussions. So we'll start with a panel discussion on unlocking the potential of pediatric digital health. Then we'll move into building with, not for, so designing pediatric digital health products with patients, caregivers, and clinicians in mind. And then our third panel will be beyond the pilot, scaling pediatric digital health for real-world impact. Then I will wrap us up with some closing remarks. Oops. And just some ground rules as we get started today. A reminder that we are recording today's session and that you will be able to find the recording and the slides that I'm presenting on our webpage after the session. And second, please type your questions or comments into the chat box as we move through. I very much would love this to be an interactive session with our audience, especially these panel discussions. So if you have any comments or thoughts that you'd like to jot down, please feel free to in the chat box, and we will do our best to address those throughout the panel and the presentation as they come up. Quickly, for those of you who don't know us, DIME is a global nonprofit and the professional home for digital medicine. So we bring together the many diverse perspectives essential to achieving a vision of better health powered by digital innovation. Really, what that means is DIME convenes stakeholders to take action to fix the problems in our complex field. And essentially, what that means for us here at DIME is DIME exists to solve the problems that nobody else can fix. And our community is really passionate and dedicated to realizing a new approach to healthcare by building new integrated systems powered by digital approaches that are safe, effective, and equitable. Let me see if, oops, sorry, I'm seeing this on my screen and just want to get that off. Okay. Well, I am really excited today to be unveiling this project. So the Playbook Pediatric Digital Medicine is really meant to distill the nuance and complexities of innovation in pediatrics and help drive stakeholders to action. In this edition, DIME and our co-host, Boston Children's Hospital, have convened a really fantastic group of project partners to dive deep into the challenges and opportunities of bringing digital health solutions to children, a population that we really know and that has historically been underserved in digital innovation. So through surveys, interviews, workshops, and a lot more collaborative work, we work to define the market opportunity, identify development and deployment best practices, and really address the unique ethical considerations for pediatric digital health products. It's been really an incredible group to work alongside, and we're just really excited to share what we've created today. With that, I would like us to get started and pass it off to Jen Goldsack, our CEO, for a brief opening remark.
Thanks so much, Ian, and congratulations to all of our partners today. This is really, I think, a watershed moment for how we're harnessing the power of digital innovation for the patients who need it most, and in this case, children. The impetus for this project actually goes back to data published by our partners, our colleagues at Rock Health. So in the fall of 2023, they published tremendous data, as they always do. And one of the top line findings was that only 4.7% of investment into digital health innovation was targeted towards solutions for children. And when we think about the proportion of our population who need care, that struck us as being absolutely unacceptable. So we dug in at DIME. We dug in and found, to the best of our knowledge, that not only was there a paucity of investment in digital innovation solutions for children to improve access, to improve outcomes, equity, quality of care, to reduce the strain and burden on families, there hadn't been a single successful exit of a company that had sort of advanced and championed this work. And what we learned further through very frank discussions from our wonderful partners at Boston Children's is that the unmet need for these kinds of solutions, and more important, clarity around what good looks like, was absolutely essential. As we chatted to our colleagues at Boston Children's, they told us about the enormous amount of time that they invested, not only with innovators who were attempting to make forward progress in digital innovation to improve the way that we care for patients, that they were spending a disproportionate amount of time in education, co-creating solutions, that there was nothing off the shelf for them, but that also they were spending time and effort away from direct patient care, thinking about how they could support other children's hospitals, other clinics, other practices to adopt and leverage some of the technology solutions that, frankly, in many cases, not all, because we have some tremendous technology partners on the project, but, you know, not quite fit for purpose for the complexities of deployment in pediatric care. And what we've done as a result of this absolutely tremendous collaboration, and so I want to thank our colleagues at Boston Children's for your true partnership. We are experts in digital innovation, but you are the experts in the care of children, and it really has been a privilege to work alongside you. It's also been a privilege to work alongside all of the other innovators, the care providers, the researchers who have come, the patient groups, the physician groups who have come to the table to say, we are going to demand the promise of digital innovation comes to fruition for sort of children. And what we've proven with this work, with this collaboration, with the sort of tenacity of this group of leaders, is that there is a market for high quality digital innovation that can address some of the most pressing needs in pediatric care. That it's possible to do this in a way that's equitable. It's possible to do this in a way where there are enormous commercial returns available. This is an untapped market. There is potential, and we have done the best of what DIME does with this work, which is we have delivered on what we believe to be a double bottom line. We can improve the way we care for children, and we can also create commercial pathways for innovation in pediatric digital medicine. I'm incredibly proud to be able to be here to offer opening remarks. I'm incredibly grateful to the leadership of the internal team at DIME, but also our partners who came to the table and said that they believe that they could be a market here too, and they were willing to invest their time, their energy, their expertise in making sure that we create a viable market for digital innovation that returns to the most vulnerable in our community, our children. So with that, Ian, I'm going to hand it back to you. I'm going to thank you for your leadership once again. I'm going to thank our partners once again. And I'm really excited for our discussion today, where we're going to go through everything that you've put into the playbook, everything that we are now not just confident, but certain is possible in the digital era of pediatric healthcare. Back to you.
All right. Thank you so much, Jen. And thank you for your excellent leadership as we continue the legacy of these playbooks that you started here at DIME a while ago. So excited for today. And I think you're spot on in these remarks, right? Funding and innovation in this space is kind of lacking or segmented. We've come to the table knowing that we need collaboration. We don't want, any more segmentation in this space. And so we've just been really fortunate enough to bring together such a strong group of a project team with diverse experiences and input, and it's all really culminated in this playbook, which we see as a critical step forward and toward ensuring that pediatric digital health isn't just an afterthought, but really a priority in health innovation. All right, so with that, I would like us to share my screen to move into a quick, a very quick tour through the playbook itself before we dive into our panel discussion. So I'm here on our landing page. I'm going to take you through some slides really quick, but we will be dropping links to the actual live website so you can all kind of peruse through on your own as well. This homepage is really setting up, about the project, why we're doing this. A lot of what Jen and I just spoke through about children comprising 23% of the population, but only receiving 10% of the healthcare expenditures. Where we do see investment, we often see poor quality products that are disappointing providers or just not quite improving care and research or struggling commercially, as we've seen in the past. We also on this homepage have the full entire playbook broken down into 4 chapters. The first is about navigating the market dynamics and sustainable business opportunities in pediatric digital health. Second chapter is really focused then on centering the user and product development. Our third chapter is more about how do we get these tools out into the world? How are we thinking about deployment and implementation across various settings? And then the fourth section, or the fourth chapter, is all about applying digital health technologies to advance clinical research in pediatrics. On the right side of my screen, you will see a few, or some icons, some red icons, and this little screenshot down here. These are the guiding icons that will kind of help you find your way through the playbook itself. We have this brain here. There are all these pro tips and strategies and recommendations that our expert partners have formed and pulled into the playbook itself. So you can look for that brain throughout the website for those pro tips. This megaphone is more meant for our call to action, kind of main takeaways from certain sections that we've written, but really here using this megaphone to make strong calls to action and highlight key points that we're pulling through the playbook itself. This little flashlight here is then used to spotlight really key information, evidence-based information. So we're talking about data-driven insights. We're referencing, peer-reviewed and other articles in there, really shining a spotlight on things that you might find interesting as our reader. And then this fun one on the bottom right-hand side are these fictional stories that we've created, personas, if you will, to really help guide us through the playbook. So we've decided that some of the topics that we cover in here are a little bit nuanced and complex. And so we thought that bringing these kinds of stories into the fold would help lend a little bit of color and kind of digest some of this complex content in a little bit more fun way. So you'll see a few different children personas, about a 3-year-old, I think 10-year-old, and then more of a 16-year-old kind of transition-aged individual, alongside caregivers and clinicians, and even school nurse professionals and things like that. So just diving in a little bit deeper before we move into the panels. Chapter 1 is really focusing on the call for, why pediatrics and why now? We are really making the case for exploring the market dynamics and showing the potential that pediatric innovation really can make. So here we're hitting on the market dynamics, the challenges of and redefining the value for pediatric digital health. We're kind of helping people navigate the road to growth and impact here. We're also then outlining some strategies for sustainable business innovation, where we hit on topics like chronic disease, mental health, early intervention, personalized medicine, really wrapping this up in an argument that children are worth investing in. Oops. Chapter 2 is all about then centering the user in product development. So this is a key theme to the playbook that we've developed, that we are building with, not for, children, caregivers, and clinicians. So here we're outlining really the complexities and nuances of children in their care systems, all of the dynamics that kind of encompass that as children age and change physically and emotionally and cognitively. We'll guide you through some design and development approaches that account for children's age and development. And then we have a final section on pediatric data and ethics, really encompassing all of these issues around data access, privacy, who has access, when do they have access to certain data, things like that, that are really complex in kind of the pediatric health journey. Section 3 then, chapter 3 then, is really, once you've built this, how are we deploying? How do we think about phases of deploying DHTs? How are we thinking about settings of care that children are receiving between schools and community clinics, typical hospital settings? We really outline in here all those settings in pediatric care, how they're interconnected, and then also how you can think about taking kind of a phased approach to deploying your pediatric digital health technology. And then lastly, a little bit of a whirlwind here. Chapter 4 is applying digital health technologies in clinical investigations. So this has been a really big one for our group to develop. Our partners have really developed some fantastic content in here around how we're using DHTs to recruit and consent children and caregivers into research, how we're leveraging those DHTs for measurement in clinical research, how how we can use them to streamline data collection and enhance data collection in peds, and then also, finally, how we're leveraging the data. How can we take the research data and ultimately inform real-world care and health technology innovation? We've also, as you'll see as you're perusing the website a little bit, developed a few other resources, including a guide to navigating the complexities of Medicaid. We know that almost 50% of kids in the United States sit on Medicaid, so it's really a natural place to be exploring innovation. But many of us also know that Medicaid is very complex. It's administered state by state. So here we're presenting a guide to help our pediatric DHT developers kind of navigate those complexities and really understand, how to approach Medicaid as a viable avenue in their business. And then finally, we've come up with over 15 case studies from partners that really are showing our expert recommendations in practice. So it's not just about telling you, here's our strategy and here's our recommendation, but this is really showing our recommendations in practice from these case studies, highlighting the incredible innovation that's happening in this space. And I'm really proud of the group that we've convened for developing such informative and actionable resources. So just like to take a minute here and call out all of the amazing partner organizations that have contributed case studies and really have put their foot in here to show us in practice what our recommendations are and how we can do them. And with that, I think it is time for us to move into some panel discussions. So I would like us to bring on excuse me, Sarah Scalia, the Director of Innovation and Business Development at Boston Children's Hospital, our co-host for the project. I'd also like to welcome, excuse me, Adriana Krasniansky, Principal and Head of Research at Rock Health, and David Bergman, a pediatrician and Professor Emeritus at Stanford Medicine. Today, we will be talking about kind of a 1,000-foot view from challenges to impact, unlocking the potential of pediatric digital health innovation. Sarah, Adriana, David, welcome. Happy to have you all here. Let's start just having you run through a quick introduction, 30 seconds or less, and then we'll dive into some discussion. And I'll have Sarah, you can start us off.
Great, happy to kick it off. Hi, I'm Sarah Scalia. I work for the Innovation and Digital Health Accelerator at Boston Children's. It's a really interesting group that combines research, technology, enterprise change management into an incubator style program to support digital health solutions inside and outside the hospital.
Thanks, Sarah. David?
I'm a general pediatrician at heart, still seeing patients and interested in children with medical complexity. I have some real world experience in terms of having spent 10 years developing a digital health tool to facilitate engagement in well childcare and shared decision making for children with special health care needs. And I've gone through to establishing a great evidence base for it, but run into some real problems with implementation and scale. So I just wish I had had this playbook before I had begun all this 10 years ago.
Thanks, David. And Adriana.
Round us out. Hi, everyone. My name is Adriana. I lead research at Rock Health. For those that don't know, Rock Health, first and foremost, advises large healthcare organizations on their digital and innovation strategies. We also have a venture fund that invests in early stage businesses and has made some investments in the pediatric space. And we also have a nonprofit that really thinks about closing equity gaps in healthcare where digital tools are appropriate. And pediatrics is an area that we've looked at there. As you mentioned, Ian, we've been looking at pediatric care since 2023 when we really acknowledged the dearth of investment relative to the need, and have also been thinking deeply about youth mental health, which is another area that we published on last year.
Awesome. Thanks so much, Adriana, Sarah, David. Great to have you here. We have a very, abbreviated time in this panel, so let's try to get through as much as we can. Adriana, I love where your head's at, and I think, a lot of the work that Rock Health did in releasing that report in 2023 kind of definitely informed a lot of the direction that we wanted to take some of this playbook. And so I'd love to hear from each of you or kind of facilitate some discussion here. Let's start with just hitting on what are the biggest unmet needs in pediatric healthcare today that digital health technologies can kind of help solve? And maybe where are we seeing the most promising opportunities for innovation? I'll let Sarah start us off, but folks can feel free to chime in.
Yeah, sure. So I think probably the biggest area when we think about impact for the technology that we can roll out is around access and equity. For pediatric care, there's a shortage of specialists. We know this. There's huge geographic disparities depending on if you're, in the Boston area. There's a lot of providers and a lot of healthcare sites here, but the country is very broad, and there are a lot of disparities across the geographic spread there, and also the insurance complexities for pediatric patients. And so, especially where any of these digital health solutions can start to bridge some of these gaps, whether that's through telemedicine or remote monitoring, AI-assisted diagnostics, we can kind of get further with the specialists and the care that we do have.
Mm-hmm.
I just wanted to add, one of the advantages of pediatrics is that we work with families, and in essence, the family is the ultimate healthcare delivery system. And I think the opportunity of working with kids, how can you develop digital health tools that cross generations and cross different family members? And I think if we come up with good solutions here, this is going to be applicable down the line and through the life course.
Absolutely.
I think I'll round us out by saying yes and to all of those. I think the reason pediatrics is really unique is it doesn't feel like one really big driver of the problem. It's actually a lot of intertwined factors. One is children access healthcare completely differently than other patients, right? To David's point, it's really a family unit or caregiver and child that comes to the process. So you have to design differently. To Sarah's point too, it is completely unlevel in the United States as to how we think about how children access care, right? We know, for example, we have to talk about Medicaid when we talk about pediatrics in a way that we might not even have to consider when we think about adult care. I think the third thing too that we haven't maybe said is the complex nature of pediatric data and pediatric UX that really requires a different mindset. So I think taking this in, it actually becomes it's a different mindset than designing for healthcare for adults. And I think that's actually the biggest challenge we tend to see is that folks don't necessarily know all the nuances when they're going in, right? And that actually makes it a more complex space to enter.
Yeah, that's a great point. And I think something certainly that we're hoping to hit on in the playbook itself is to really outline those complexities and the dynamics so that you can think about how we're designing, solutions to collect data, accurately and appropriately in children, and then also how they're using these tools is certainly an important topic. Adriana, you mentioned Medicaid. It's something that Rock Health has certainly spoken or written about. And David, I know that, we've spent a lot of time talking about Medicaid here in the playbook. Let's kind of double click on that and talk about just the opportunity to reach children on Medicaid and kind of how we see this as an opportunity for digital innovation in pediatrics.
Well, Medicaid's kind of the 800-pound gorilla in the room. As you highlighted, a significant proportion of our kids are under Medicaid and CHIP. It's problematic because it's fragmented with each different state having a different program, but even more so within states, managed care organizations operate with a fair amount of independence. So it makes the environment seem kind of Byzantine. All that being said, there are some interesting opportunities out there with innovation within Medicaid. And what has been the essential factor, success factor, has been sitting down with Medicaid at the table when you start your innovation. And when this occurs, people have been able to come up with alternative financing mechanisms, because one of the things we're set back by is our fee for service. And there's very few digital health tool episodes of care, no CPT codes, no way to bill for them. But there have been opportunities, if you sit down with Medicaid, you redefine perhaps funding care across different providers along an episode of care and other innovative mechanisms.
Yeah, I'll build on that. I think David really hit it on the head that, when coming into Medicare, it's inherently an uphill battle, right? For any kind of product innovator or new solution to kind of bring forward approach. But at the same time, you do have young people and children and families with young people who are digitally native. They're already going through the rigmarole and the challenges of trying to stay enrolled in Medicaid, maybe moving between states, et cetera. But I think also the biggest point that we don't talk about is if we don't address these, if we don't build healthy habits or good relationships to healthcare providers and healthcare generally early on, it sets us up for really big chronic condition needs, longer term comorbidity needs. And because we have such a challenge to engage early on with young families or young children, it's a compounding issue. Something that inherently David mentioned is that's not necessarily on something that MCO is going to really feel strongly tied to in terms of their what they're taking on. But when we think about it more broadly, that's kind of how we have to think about bringing digital first in. It can't just be a waiver, it can't just be a component. It actually is how folks are building their healthcare relationship.
To the foundation of their healthcare relationship.
Yeah, Sarah, I would be interested to kind of hear your take on this as, a representative of these healthcare systems and delivering these. How have you seen you all work alongside Medicaid or alongside digital health kind of companies exploring that space?
Yeah, I think that in our experience, results speak louder than anything else. And so opportunities that we've had to de-risk these opportunities or prove out results, whether it's in a small pilot or in partnership with, we have an ACO affiliated with Boston Children's, kind of proving out, here's our theory, here's our hypothesis on how digital health or digital health tools can help in XYZ way. And then being able to show those results, whether that's over the course of a couple-month pilot or a several-year-long program, gives us so much more firepower when we're negotiating and trying to advocate for changes in coverage or policy. And so we're very blessed that we have the resources to be able to kind of foot the bill or de-risk these things. But I think that's the responsibility of some of these large academic medical centers. It's to work in that way so that it can spread across the whole system.
Absolutely. Yeah. Thank you for that. And thank you to the three of you for, sharing your thoughts here and really, I think, double clicking and highlighting on the focus of our next panel too, which is centering these family systems and really, not losing sight that patients and caregivers are who we're here to serve and help, and really exploring all of these different pathways and ways that we can do so. And so obviously Medicaid is a major opportunity here. Digital health is a major pathway to be reaching kids and to be personalizing care and to be delivering, solutions that are accessible to everyone. And so certainly a lot to look forward to. And I thank you all for your comments and participation today. And we will shift into our next panel as I share my screen briefly. So now I'm excited to welcome Amy Moulton, the chair on section on advances in therapeutics and technology at AAP. Olivier Stacquet, the chief technology officer at Gabby Smart Care, and Katie Taylor, the CEO of Child Life on Call. So hello, everybody. Looks like we're all on the screen. Just like the last panel, just want to give you each about 30 seconds to give us a quick intro, and then we'll dive into some discussion. And I will start with Amy.
Great. Can you hear me okay?
Yes.
Yes.
Awesome. Thanks for being here, everyone. My name is Amy Moulton. I'm a general pediatrician with my clinical practice and teaching deeply rooted in community health. I've been innovating in the health technology space for about 5 years now, having led strategy and operations for 2 separate AI-focused health technology, sort of adult-oriented startups, and now I'm the chief medical officer for Ladder Health, which is a new approach built with Boston Children's to work with children with developmental delays. As Ian mentioned, I'm also the current chair of the section on advances in therapeutics and technology at the American Academy of Pediatrics. I'm a clinical assistant professor at Tufts and support multiple nonprofits and early stage companies working to further health equity and access through the use of technology. So really happy to be here. I've been very happy to be part of this project and happy to talk about the questions that come next.
And Olivier.
Hi, everyone. I'm Olivier. I'm in the software industry for 20 years now. I joined Gabi SmartCare as CTO 4 years ago. And at Gabi, we are building remote patient solutions for pediatrics only. I'm responsible for product development, software engineering, data science, and cybersecurity. And I'm passionate about working with digital health innovators. So if you want to exchange one day, happy to connect and glad to be here with you guys.
Awesome. Hi, everybody. I am Katie Taylor. I am a certified child life specialist. Many of you have probably not heard that word or phrase before. We work in pediatric healthcare and help kids and families cope with the psychosocial aspects of being in the hospital, from understanding diagnosis to end of life and everything that happens from NICU all the way up to supporting children of adult patients. I am the CEO and co-founder of Child Life on Call, and we have developed digital health technology to help expand and empower parents. As a child life specialist myself, I saw firsthand how important it was for parents and caregivers to not only be on board, but to be empowered and informed with all that needs to happen as they navigate healthcare. We saw a tremendous rise in parents feeling empowered, and then that leads to better outcomes for their children and better lifelong relationships with healthcare in general for the entire family. So I'm very happy to be here with you all.
Excellent. Thank you all. And I think a great place to start, as we were talking about in the last panel, really centering, the family experience and what we're doing. And I think a lot of what we developed in our second chapter of the playbook is all around centering the user in product development. And so, when we're thinking about who's using these tools, it's patients, it's children, it's their caregivers and family members, it's their clinicians, it might be their school nurse or somebody else involved in their care. And so these care systems are really complex. And I'd like us to start here just by running through the room and talking about how can stakeholders, how can we ensure that pediatric digital health tools are really designed in a way that is user-centered and meets the needs of children, families, and even the clinicians that are being tasked with deploying these tools in practice. Let anybody kind of take that first stab at it.
Well, I don't mind going first, simply because I think if there are pediatricians or other clinicians on this webinar with us, they'll know first do no harm. And so I come at this just with quite a few decades of direct patient and family care and advocacy. And I feel like to truly advance digital health, I think we all need to agree to establish a foundation of high reliability. And this responsibility extends beyond the clinical teams who might be making recommendations to those points. It's really to include the technologists, the business leaders, and every stakeholder involved. I don't think any digital health initiative should move forward without some of those rigorous safety and quality standards in place that patients really deserve. So when I think about it, it's about sort of being obsessed with what could go wrong, how things could harm patients and families, to prevent that, not because it will, but because we need to talk about it and work to prevent it, really resisting the urge to oversimplify things because we're dealing with complex health processes and it's hard. And so really just making sure that we are making decisions that are on behalf of real life and sort of the real patients and families that are at the end of these tools that will be used. So I have a lot of other thoughts. I'll let others speak, but that's the first one that comes to mind for me.
I'll add on to that, Amy, because I think what you said is exactly right. And there's also paying attention to the caregiver burden. So we talk about the parent being completely overwhelmed, not only because their child is going through something that's difficult or perhaps painful, or managing appointments, being the best historian, being the expert, the insight on the parent. So any digital tool we create has to seamlessly integrate with their existing life and solve a problem right now. I was just speaking with a mom last week, and she was telling me that unless she brings a physical other person with her to the doctor's appointment, she doesn't remember anything. Her son has a condition that he can't stop moving. So she's either managing her son or choosing to listen to the doctor, but she can't possibly do both at one time. So when we're developing products, we have to look at, does this help you right now? And does it support you right now? And is it effective in doing that?
And I agree with you. I think the challenge is that humans are very patterned, but each individual's barrier to health improvement can be very unique. And so when we're designing, that can actually take a lot of time. And I remember having been advised in the past by executive teams to stop thinking about the edge cases. You can't always think about the edge cases. You just think about the average person. But when we do that, there's risk. And so these edge cases are important. I think we need to find that balance between moving quickly to get these tools that can be very valuable to patients and families out there for them to use, but keeping each and every person and family in mind when we do that.
We are touching especially a good point here, because on one side we have the safety, the reliability, and the accuracy of the tool, and to be sure that there is no risk. And the FDA is well aware about that. It's all tool that we can put on the market is really risk-driven, to be sure that there is no risk remaining for the patient. And I like what David said during the first panel, is that the family is the primary caregiver. They are taking care about the child. And it is important, as Katie say also, that it's not only the patient when we are talking about pediatrics. I would say it's an ecosystem. It's the ecosystem with the parents, with the pediatrician, with the specialist, with the caregiver, with the teachers. And, it's not only the patient. And even if the patient is the ultimate beneficiary, there is also all the people around that. It's not, I would say that a one-to-one relationship with the patient as it is with adults, especially with digital health. It's really taking care about the whole. And it's not always easy when we are developing that, because it's important to consider the view of the different stakeholder. So the parents and the pediatrician, the physician, and the first step, especially when the kid is young, and I will say the complexities that it evolved during the life of the child. Say below 6, the child, I would not say that it doesn't care about their health, but they don't know, and yeah, they don't have it's not tangible for them. And then you have 6 to 12. It's a bit different, because they are starting to wondering, okay, what happened to me? And after 12, my kid is 13, so I'm starting in the phase, I would say the difficult phase. And later, when I would say young adults or late teenager, depending on how we call that, it's also another story, because
It gets
there
worse.
is some part.
It gets
and it's some part of their life that they don't want to share with their parents. And so it's really, that's the complexity. And digital health is often about data, and it's important to thinking about that early in the process, to know how we can share the data with the different stakeholders to be sure that there is no impact. And there is a great part in the playbook about that, about how we can manage the different age range, I would say, because it's never white or black, but the age range and how we can deal with that during the life cycle of the child.
I'll add in just one other part, and we really built our product based on conversations and experiences of parents and caregivers, and just being willing to listen. And because we may think we have an idea about what could help or what could be a great solution, but it ultimately has to come from them, especially in a patient-facing solution. With that said, understanding and learning and helping them be a part of the product development was almost the easy part. And the hard part is scaling these digital health solutions, maintaining a company as we're trying to build and do the right thing and do no harm and create all of these things. And then really finding partners within pediatric healthcare who are willing to take a chance on a solution like this. And I'm sure you'll get into that into chapter 3.
Yeah, that was a perfect segue. Thanks for teeing me up there, Katie. But I think, this panel really highlights these complexities and the nuance that we're dealing with in pediatric care, from the children and their caregivers to all of the different specialists and professionals involved in, helping our children succeed in life. They all have unique perspectives and insights to bring into the products that we're developing. And so, hopefully we've shown here that it's really worth taking that time, taking that input to build tools that are safe, that are effective, and that are reaching the people that we want them to reach, and helping them in ways that, we're intending to. Katie, you had a great, mention there in terms of how are we scaling these tools, right? How are we thinking about, okay, we've gone to a hospital system and we've piloted this tool, but how can we actually start to reach the masses? And so I'm happy here to bring on our third panel to discuss that. I'm actually going to take a little bit of a back seat and let Sarah Scalia from Boston Children's moderate this one. So I will welcome you, Sarah, and the rest of the panelists to the show.
Thanks, Ian. Yeah, and so we have 3 fantastic panelists that will be spotlighted very soon, Mary, Katerina, and Sally, and I'll let each of them introduce themselves in turn. So it looks like Mary, we've got you spotlighted. We'll start with you.
Great. Thank you so much for having me. I'm Mary Mulcair. I'm an emergency medicine physician. I take care of newborns all the way through to centenarians. And in my current role, and the reason I'm here, is as Chief Medical Officer of SUMIS. And SUMIS is in the clinical navigation space. We're a tech-enabled proprietary platform designed to accelerate speed and access to high-quality medical expertise, with the overall goal of, spreading that expertise and the specialism that's really concentrated in certain areas out around the country to other folks, and then drive better medical decision making, at the local level for different people to drive better clinical outcomes.
Great. Sally, can we have you go next?
Sure. I'm Sally Gazaraka. I work at Children's Mercy Kansas City and International Services and Business Development. And I also worked really closely with their Center for Pediatric Innovation. And as a result of all of the challenges that everyone has talked about during this entire webinar, of just understanding the challenges of getting highly collaborative products and getting them to market, we started Peds Market as a way to really be a platform to connect all of us together and collaborate throughout the development process, and then also give a more efficient way to allow products to go to market.
Perfect. Katerina, if you could round us out.
Hi, everyone. My name is Katerina Plotzek. I work in digital health sciences at Takeda, and we are involved in putting clinical trials with digital health components in practice. This involves evaluating and selecting and implementing digital health tools, as well as working with their data to develop reliable endpoints that we can use moving forward. And I've been really excited to be a part of this playbook, because Takeda is actually quite invested in bringing new digital health products in pediatrics to fruition. And more recently, I've been involved with a verification and validation study looking at some of the pediatric digital health products in use on the ground in kids ages 2 to 12, and seeing if they're usable, if compliance is good, if the data are appropriate for use, and seeing if they're fit for purpose for use in clinical investigations. And I'm really happy to be here today.
We're happy to have you. All right, so for this panel, we're talking through, couldn't tell already, scaling pediatric digital health for real world impact. This theme is throughout the playbook, but the real focus of it is that third chapter around scaling. So to start off, what strategies and collaborations are needed, are most important to scale pediatric digital health innovations? effectively and equitably here. Sally, I think we'll start with you. I know that you had a couple thoughts you wanted to share.
Well, I think this is actually why Children's Mercy Kansas City, we had an entire pipeline of innovation that we wanted to get to market. We had done clinical validation on our particular patient population. We're ready to share it with others. And then we couldn't sustain any of the go-to-market plans because they were too expensive to build from scratch for each individual innovation. We talked to startups, we talked to other institutions, and it was the same theme that we've all talked about today here, which is it's a fragmented market. There's developmental and community, patient and family factors to take into account. It's very fragmented when you go into any given institution. Who is the decision maker? Who is going to help not just pilot this, but also get it through any of the purchasing requirements? And we also found that there were a lot of institutions that were doing the same exact, or trying to solve the same exact problem. And while resources are so limited, as we continue to hear, and we're all very mission driven and trying to get better outcomes for the patients and families, we've really found a need for us to work throughout that entire value stream, the entire development process. How can we talk more frequently and earlier in the development process so that we really don't have a big enough market to have high competition solving the same need. And so seeing the mission-driven view of everyone trying to really catch pediatrics up to the adult market, Peds Market is a platform to drive that collaboration, but it can't just be among pediatric institutions or among startups or among investors or among major manufacturers. It really has to be the entire ecosystem because those barriers that need to be streamlined and require all barriers across that entire value stream. So we're really excited to see this playbook conversation of everyone coming together with their expertise, the area of focus and their passion, but then also continuing that dialogue going forward to say, what can we do to work together to collaborate on shared insights, shared needs, but then also take away barriers on the dissemination of things that have been vetted by the respective entities along the way.
Completely agree with all of that from our point of view. Mary or Katarina, I want to kind of give you the opportunity to share the other side of this equation. How is it easier to collaborate with folks in industry, whether it's a startup, pharma, et cetera?
If it's okay, I'll jump in here. So I heard this from one of my wonderful colleagues, Carrie Northcott at Pfizer, and she's always said that pharma companies should be competitive on our product, not our data. So I think the name of the game here, as Sally was so eloquently putting it, is collaboration. We are all solving or attempting to solve the same problems across the board with getting pediatric digital health products up to snuff and ready to use in our clinical trials. And I think one way that we can do this is to really not only work together collaboratively across, for example, the sponsor industry, but also work with digital product developers, iterate with them on their products, show them that we as sponsors are excited to use their products and willing to give them feedback on what works, for example, to speak a bit selfishly with regards to clinical investigations, and help contribute also by disseminating data when appropriate for how we use these products as well. And I'll let Mary respond as well.
Yeah, no, agreed. Sort of from the startup side of the house, I think, a lot of it is data driven, and a lot of it's also just understanding vulnerabilities, right, of each side of the house and making sure that you can collaborate positively around it. I think, people often, do ask about, reimbursement and who's going to pay for this and financial aspects of it, right, which is a really big issue. And I think, the first panel touched on it, especially in the Medicaid population, how it's really a problem. Jumping a little bit forward to talking about AI next, but I think there are ways that, especially on the startup side of the house, where we can pivot a little bit more quickly and try and innovate a little bit more quickly and move more quickly than a lot of the more massive institutions that really bolster our overall healthcare system. We have the ability to try new things, and we may fall down sometimes, but a lot of times we can also discover amazing things, and AI is in that category. I think it's less of a question as to can AI help versus when, where, how, and it's coming, and it's here. In the next 5 to 7 years are going to look very different from how they look now.
Now let's stick with you here and talk a little bit about the role that emerging technologies, especially like AI, can play when it comes to scaling and transforming pediatric healthcare.
Yeah, so as a company that really, so we're very physician first, right? Like our goal is to allow physicians to disseminate their expertise and to do it, seamlessly and in a way that patients and families can understand and help promote care in local environments and really get, people down the right path. AI has a huge role in that in terms of reducing clinical administrative burden, helping, everything when you think about like medical record summarization and, things that, yes, you still want a human eye on it to make sure it's all accurate, but there's a lot of time spent doing things that you don't need, a specialist level of expertise to be doing. And so if we can really allow the physicians to spend their time, thinking critically about cases, disseminating the information they need to do, and with a human touch, that's really important and a high value for every single person involved. And then hopefully, you can help bolster those razor thin margins that exist at institutions, and then they can pull that back into innovative cycles, to try new things and to help support financially these programs. And the money also goes direct to, departments and divisions and helps, it all comes around in terms of how you help, deliver care and be more creative going forward.
Absolutely.
If I can, I'd like to jump in with
Sally or Katerina, please.
With how AI is also used with regard to data analysis and predictive analytics. So I think about AI more on that side as I work with the data coming off of these digital health tools. And one thing that's really interesting to me is we have some really great algorithm development going on, but a lot of the algorithms are trained on adult data. And this is a problem when we're working with special populations that vary across age ranges, right, from 2 to 18 if we're considering, or 0 to 18, excuse me, if we're considering pediatrics. And also how certain algorithms may be biased towards adult data rather than children's data. We have to consider the developmental stage of the child in algorithm development. And I also think, though, while this may be a little bit more legwork for digital product developers, it'll be incredibly useful as children oftentimes may lack the verbal or cognitive abilities to talk about their symptoms, and having quantitative measures and algorithms that can flag certain events, for example, sleep or scratch, or something that might be harder to capture on a very frequent quantitative basis, would be incredibly useful.
And Katrina, just to add on to that, I think the fewer data points that exist within pediatrics, especially when you have to segment based on condition, based on developmental components, really requires us to be more collaborative so we can ethically make sure that these AI models are really accurate for the pediatric population. So I think as we go into AI development, the ethics and the training behind it really requires those with the expertise to collaborate to make sure that we are really feeding in the right most accurate and appropriate data into them.
Absolutely. And I would like to call out someone in the chat, John Birch, who was bringing up the idea of digital twins. And this is an example where we can use big data and AI to potentially solve for some of the issues with fewer data points in pediatrics, especially segmented by age groups.
Absolutely.
All right, and I think we'll end on that note. Thanks so much to all three of you. It's been really fantastic.
Thank you.
Excellent. Thank you, Sarah and Mary and Sally and Katerina. Thanks to all of the panelists. We are, bumping up against time today. I like that we're kind of thinking, we're future thinking here. With this last panel, Future Thinking at Dime, I wanted to share a few upcoming projects that we'll be starting here at some point in the first half of this year. The first is around pediatric rare diseases and defining a core digital measure set for these pediatric rare diseases to accelerate research and transform care. So more of this PEDS kind of angle happening here at Dime. You can visit the project page or scan this QR code for some more information. We also have another project coming up about optimizing treatment of type 2 diabetes using sensor data. Again, you can find some more information and sign up to participate using these links. And then finally, some of the topics that we've actually touched on today: integrated evidence plan. How are we thinking about generating data throughout the life cycle of a product? Our colleagues at Dime here have created a great resource on integrated evidence plans. And on March 18th, we'll be hosting a webinar to discuss kind of streamlining evidence for commercial success to drive broad acceptance of digital health technology. So encourage everyone to take a look at what's coming up on the Dime front. And, with that, I would just, like us to wrap up today's event by giving one last acknowledgement to our amazing, incredible collaborators and project partners on this team. I think, a really unique message that we hit home today, hopefully, was this is a collaborative effort, right? There's a lot of different stakeholders and a lot of different players in this ecosystem, and it only benefits patients if we can all come together and work together to, create tools that are personalized and scalable and safe and effective. And so, I'm really proud of what this group has come together. And over the course of the year, we worked to define the market opportunity, identify these development and deployment best practices, and address, all of these ethical kind of unique considerations for pediatric digital health. Our goal was not just to outline what's needed and say, here you go, but to really provide some actionable insights that help our stakeholders, from our clinicians to our researchers to caregivers and innovators, to really learn how to advance digital health solutions that actually are meeting the needs of children and families. So I'm very proud of the resources and the work that this group has pulled together over the course of the year, and we hope that you will certainly all find them useful. So one last, major thank you to all of the partners and colleagues who made this special and made this possible. And thank you everybody for joining us today. I hope you all have a wonderful rest of your day.